ADHD or disruption, the hidden crisis affecting Black children in U.S. schools. What if the behavior some teachers call defiance or disruption in Black children is actually a misunderstood medical condition? A new report from the Centers for Disease Control and Prevention, CDC, has revealed that 1 in 9 children in the U.S. has been diagnosed with ADHD, an alarming rise since 2016. That number reflects greater awareness of ADHD symptoms, impulsivity, hyperactivity, and difficulty focusing. But here's what's deeply troubling. At the same time ADHD diagnoses are increasing, Black children are disproportionately punished in schools for behaviors that closely resemble these very symptoms. Across the country, Black children are more likely than white children to face suspension or expulsion for broadly defined infractions like defiance, disruption, or insubordination, even when those behaviors may stem from undiagnosed or misdiagnosed ADHD. This isn't just about discipline. It's about a system that too often misunderstands, mislabels, and mistreats children who are in need of medical and emotional support. Although the CDC report shows that Black and white children are diagnosed with ADHD at roughly the same rate, about 12%, a 2022 study published in Psychiatric Services reveals that Black children are significantly less likely to receive treatment. Those who do get help may disengage from treatment more quickly or receive lower quality care. These disparities are fueled by a complex mix of cultural stigma around mental health, limited access to quality care, and bias within the predominantly white field of behavioral medicine. Sharif El-Mekki, CEO of the Center for Black Educator Development, warns that Black students, especially boys, are often misdiagnosed with more severe conditions like schizophrenia when their behaviors actually align with ADHD. He explains that the issue is both overdiagnosis and underdiagnosis, depending on the lens educators and clinicians use to interpret behavior. Too often, cultural misunderstanding in classrooms leads teachers, many of whom lack adequate training in behavioral health, to interpret normal ADHD-related behaviors as defiance or aggression. Without enough culturally responsive counselors or school staff, Black students are pushed out of classrooms and into disciplinary systems. Environmental and social factors compound the problem. From home instability and poverty to exposure to lead and other environmental toxins, many Black children face additional stressors that can intensify ADHD symptoms. Still, instead of support, they often get labeled, isolated, or punished. And perhaps most concerning of all, many Black students never even get the chance to speak to a counselor who looks like them or understands their experience. In most schools across America, teachers are overwhelmingly white. In schools with majority Black student bodies, there may be no mental health professionals on staff at all. When we blame children instead of supporting them, we create excuses for why we can't teach them and why they can't succeed, says El-Mekki. This is about more than diagnosis. It's about justice, equity, and the future of a generation of children whose needs are being overlooked and whose potential is being buried under discipline reports. If you're a parent, teacher, counselor, or community leader, click the link in the description box for vital resources, expert advice, and tools that can help change this broken system. Learn how to recognize ADHD symptoms, where to get help, and how to advocate for the children who need us most. We can't afford to wait. The future of our children depends on action now.